Well, hello, it's Dr. Chris Lauria from Roanoke Knee Solutions, and we're back here today. It is a Wednesday. Hopefully this weather's changing. It looks nice out there today. I think it's starting to warm up, so we're excited about that and finally getting rid of this winter. Heck, if you have knee pain, this winter's made it worse too. If you have back pain, this winter's made it worse. That cold weather stiffens everything up. So, hopefully some of the people that are suffering that will feel better too. So anyway, the other day I did a live stream on our back pain site for the decompression, the laser treatment for degenerative bulging, ruptured disc. We talked about failed back surgery and what could be done to help people that have had 1, 2, 3 back surgeries and haven't gotten any relief. Well, today we're going to talk about, because I have patients that show up that have had knee replacement surgery, and unfortunately that didn't help either. Knee replacement usually helps people a lot, but there's a good percentage of people that still deal with a lot of pain. Sometimes people have more pain, or they can just have soft tissue pain where the replacement, the soft tissue around the knee where they fixed all that, is causing symptoms with people too. So they're coming to me for relief, because once you get that surgery, just like metal rods, screws, and plates in your back, that surgery is done. There's not a lot that can be done to help that. The first thing that I ask them is that the surgeon has checked the replacement itself to make sure it's functioning properly, because there is sometimes malfunctions in the prosthesis itself. It's moving. It's not functioning properly. That can cause significant symptoms, especially in the areas that it's attached in the leg bones, the femur. Those areas can get loose. Sometimes if you're feeling cracking up in your upper leg bone or down in your shin bone, that prosthesis isn't working properly. So what will happen is the surgeon will take some x-rays. He'll retest it to make sure that it is functioning. If it isn't functioning properly, then there's nothing we can do. That's something that has to be surgically repaired in that case. Now, if the prosthesis is working well, that the doctor checks it, everything's fine, the x-rays look good, that it's aligned properly, then there's some things we can do to give you relief. Again, we're limited. We're just trying to give you soft tissue relief through the means that we have here that are usually don't involve taking, painkillers and medications like that. Doesn't involve any kind of shots or anything like that to help the pain. So they're non-invasive. Nothing we do here can affect that replacement. So we're not doing anything that would damage the replacement. There's no manipulation or anything like that. The treatment options here would be laser therapy, either class 4 or cold laser therapy. And what laser does, it sends laser waves into the tissue. It causes red blood cells to run to the area, and red blood cells are what heals things. So flooding that area where your pain is with increased red blood cell activity can help with pain, inflammation, irritation, and those type of things. The second treatment we have is something called vasopneumatic therapy. And what this is a series of cups that'll go on around that replacement. It drives electrical energy from cup to cup. Again, multiple things happen with vasopneumatic therapy. Very powerful. It'll help with pain, inflammation, irritation, no doubt. There's electroanalgesia, electronic pain blocking, which will interfere with pain signals that you're having there too, and interrupt with the pain signals that are happening because of the replacement. This will also help to pump any swelling and edema out of the tissue. It'll help the soft tissue heal and cut down on inflammation in the soft tissue. It'll also induce muscle balance and reduce muscle spasm that you're having due to your body trying to adapt to that replacement too. So that's a very powerful treatment that we do with many, many people that come in here where their replacement just hasn't helped with the pain they're dealing with, or they're having some kind of other symptoms due to that. So the key is if you're dealing with this and you like to see if you're a candidate for any of these treatments that it can help, you got to come in and see me. We'll do a examination, review of those x-rays that you've had done, test your knee to make sure that these type of programs and these type of treatments are going to be safe and that they're going to be effective in your case. So you can set up an evaluation here in the office. As far as the vasopneumatic therapy goes, many insurances pay for that type of treatment. If that's something that we feel could help you, you'd be subjected to deductibles, co-payments, and those type of things. Laser therapy typically is not an insurance-based treatment. There's some insurances that'll pay for cold laser, but we'll just have to figure that out. But you could come into our office and get an exam and allow me to check it out and see if it's something that these treatments could help you with. And again, most cases we're able to give people relief of their symptoms. We're not correcting anything, but their quality of life improves, their ability to do things that they want to do improves also. So call our office, 540-725-9501, or you can email me at drchris@lifestyle-chiro.com. You can message us on Facebook, LinkedIn, wherever you see this, or my YouTube page, and we'll see what we can do to help you. Okay. Hope you guys are having a great day. If you have any questions, don't hesitate to call. Thank you.